Well, good morning, everyone. Welcome to UCCR's first online webinar, and we're really happy to have you here with us. If you are on a computer or a phone, the only thing I would ask, if you haven't been on Zoom before, is just to mute your microphone. If you scroll your cursor down, you'll see down on the left, there's a little microphone that says mute, and you can just click that and it'll mute you. We will have a time for questions, for just a Q&A at the end of the webinar. And so then we will ask you to unmute at that time if you have questions. So happy to have you all with us. Many people are going to be receiving this as a recorded version, and we certainly can send it out to you if there are other camp directors or healthcare providers at your camp who would be interested in going through this information today. Mike Carr is the president of UCCR, and he will be providing our content today. So good morning, Mike, and welcome. And I'm going to turn it over to you. Everybody hopefully is seeing your screen here as you lead us through the resource guide for healthcare providers at camp. Mike?
Thank you, Tina. Great. Let's get into this. So thanks all for tuning in. Without good health care at camp, it's difficult for everybody to enjoy their time. I think all of us in camp have been in situations where a health issue has really overtaken the thoughts of the staff, and of course it can overtake the thoughts of the campers. And so starting from scratch with good health care, just getting the information out in advance and doing a pre-screening when people show up and having the right information at camp for the healthcare provider is just such a big part of a successful camp. So what I'm going to do today is I'm going to go over the best practices of healthcare at a UCCR facility. Some of my knowledge, I would say the majority of the best practices that I'm going to go over today are based on the American Camp Association accreditation standards. And I've been an accreditation visitor for, I don't know, maybe 17 years now. So I've seen a lot of variations on healthcare at camps and different types of camps. And there's so many different types of camps out there. However, that's pretty much the core of the healthcare is similar at all these facilities. I think most of you are aware that UCCR requires that the group that's using the site is responsible for providing their own health care. So, a long time ago, UCCR used to provide the health care, but then we got out of that and said, hey, it's much more relevant to the group if they provide their own health care. So to assist the groups with successful health care, UCCR provides a health care guidance through a booklet developed by UCCR. The name of the booklet is right in front of you there, the Resource Guide for Healthcare Providers at UCCR Facilities. Let's see, again, the basis for this booklet is based on American Camp Association standards. There are state laws that vary, so primarily around when healthcare needs to begin to be provided by a professional. So in some states, if the group is staying for 72 hours, just as an example, if the group is staying for 72 hours or more, then state law, actually, not American Camp Association, but state law requires that a professional health care plan is in place for groups staying more than 72 hours. But that varies state to state. So as an example, in California, there is a law, a set of laws. It's actually quite a few of them, and it's called organized camp laws. And they are laws that were established by the state of California to govern a healthy and safe camp experience. And so you can look at your own state if for organized camp laws And if you don't find it there, I've found it on other states, in other states outside California, under the Department of Health. Michigan's got it. I think in Michigan, I think it's Recreation Department, Michigan Recreation Department. So if you do a search, probably find it. So anyway, let's take a look here at the, let's take a look at this booklet. And this booklet was developed years ago, but we change it up. We update it as often as need be. So as a healthcare provider at a UCCR facility, or even as a group leader, let me say, your healthcare provider will be provided with the information we're going to take a look at here. And your healthcare provider should be receiving this information in advance. So when they get to a UCCR facility, they're not seeing this information for the first time. So this is a booklet that we're going to go through, and you can get this from the UCCR site director, and you can ask for it, or the UCCR site director will send it to you. So the second page here will have the list of phone numbers, the nearest medical clinic. As you're aware, that we work in some pretty rural areas, and so we don't have access actually to an immediate like large hospital, large healthcare center. But usually where we do operate near at least a clinic, an emergency type of clinic. Poison control number will be on there. CPS, Child Protective Services number will be on there. And then the site director name and number. And that's on, the site director name and number is on there because health issues happen 24 hours a day. And if it's the middle of the night and you're getting woken out of your slumber and you don't remember the phone number, the name and the number will be on the inside of this. When you get inside the booklet, there are a table of contents, and we will go through these different areas. So the role of the health camp provider, then we get down to the pre-camp responsibilities. And so the pre-camp responsibilities, very important that healthcare is taken care of before the camp begins, because again, it can just kind of take over camp if there's not stuff done on the front end. Responsibilities during camp, responsibilities at the close of camp. So we will go through all of these. I've highlighted areas that I thought were really important, so I didn't want to go through it just word for word. So the role of the camp healthcare provider, it's a real important resource in the successful program of any camp experience, as I mentioned. As a healthcare provider, you will need to work closely and proactively with both your camp director and the UCCR site director. Your camp director is responsible for all aspects of the camp program, obviously. Your camp director puts all the pieces together, not to feel like there's a big weight on your shoulders, but you've got all the aspects of camp that you're responsible for. And it's a big job to take responsibility for finding a healthcare provider and making sure that healthcare provider has all the resources they need. Also, the UCCR site director is there to support you in your role. So all of our UCCR site directors are trained in healthcare management at the facilities, so they can be there to provide you with information and their experience. And the experience part there, I think, is important to rely on and just realize when I say experience is that, you need to remember that these site directors, it's not just your group that comes along their site. They have groups of all manners, all different ages, all different types of group, all different ethnicities, all different focuses, all different age groups. So, you might come across something when you're a healthcare provider or as a camp director, and you're not sure how to deal with it. And I would really recommend that you go to your site director, because again, they have experience with so many different types of groups. And because you will have the opportunity to relate to campers in many different capacities, be sure you are trained and familiar with all of the legal and policy issues pertaining to working with children. That's kind of that's the heavy part, right? That you're familiar with all the legal and policy issues pertaining to working with children. Your camp director or sponsoring agency hopefully they should provide you with training and information to you about these subjects. So, just in kind of the biggest, broadest issue pertaining to working with children basically is the rule of threes, right? You never want to be alone with a child, right? You always want to have that rule of three. There should always be three when you are with a child or when there's an adult with a child. So let's move on to the next page here. So this is the policy regarding healthcare at UCCR sites taken from California organized camp law. As I said, in California and for other states actually also have adopted the 72 hours, but less than 5 days. The healthcare requires, section 1, 2, and 3. I didn't want to go into this too much because this is California, but I do want to make sure that you realize that there's camp laws that you do need to follow. Some states I think haven't evolved to the point yet of realizing they need to have camp laws, but I'm pretty sure all the states that UCCR works in do have camp laws. So for California, down here at the bottom of the page, the camp healthcare provider is either a physician, this is for group staying 5 days or more, okay? The healthcare provider is either a physician, registered nurse, licensed vocational nurse, or a person who has at least 15 hours of health and safety training. The person with 15 hours of training, the training shall include the following components: pediatric first aid, pediatric CPR, and preventative healthcare practices, courses that provide instruction in the recognition, management, and prevention of infectious diseases, so including immunizations, prevention of childhood injuries. Training may include instruction in sanitary food handling, child nutrition. Probably not. You probably don't need to pay it. That's probably not going to be something that you're going to need to understand as a healthcare provider, is the instruction in sanitary food handling. However, I think you could look at this and go, holy mackerel, 15 hours, how am I going to get all that in? Where do I find that training? Red Cross is a great place to get this type of training. So 15 hours may be the course of a week or over a couple of weeks. If you do get certification from a recognized organization, so if somebody opens up a pop-up shop on the corner and it's going to be Mike's Healthcare Training Center, I might not have any background. So you want to make sure that your healthcare provider, if they're getting certification, is from a recognized healthcare provider trainer. And Red Cross is the best place to begin there. Once you get that certification, usually all you have to do is just, usually that certification is usually good for a number of years, and you want to make sure that you keep that certification up. I know it's a challenge with camp, just getting counselors and chaperones and healthcare providers to be there on a continuous basis year after year. But if you can get somebody who's interested in being a healthcare provider, help them to maintain their certification once they get it, whether that's through paying for the course or whatever it might be. So then on the next page here, unless your program is an adult-only camp or family camp, and a family camp is a parent, guardian, or for each child is present, you will need to have each camper under the age of 18, as well as all staff members, not just staff members under the age of 18, but all staff members complete a medical form which contains the person's health history, a statement of immunizations, and overall health status of the individual. The form must be at the site at all times. So I think all of you have evolved to having a camp registration form. If you need help, please get a hold of Tina or myself. There's examples online. You can go to the internet. There's all sorts of examples all over the place. American Camp Association, they make them available pretty much to everybody. They just really care about the health of the camper, and they have a very complete one. And it says here that the form must be at the site at all times. So that's kind of tricky. For your camps that say want to go out and go boating on a lake or go canoeing down a river or go to a public pool or a public water slide area, you know, you need to take copies of those registration or medical forms with you when you go off site. Something might happen when you're off site, and it's not convenient to call back to the camp and say, hey, I need you to pull so-and-so's health form. It's much better to have those forms, have copies of those forms with you. And then that next bulleted or highlighted area goes into the, as I was talking before, American Red Cross or American Heart Association. And the certification needs to be current. So here, you know, again, we'll state UCCR, we don't provide medical supervision, medical treatment and or maintenance or dispensing of medication to campers. The site director will check in with you upon your arrival to camp to orient you to the camp, the infirmary, the medical logs, the emergency procedures, et cetera, everything. We want you to be successful. Again, this is such an important part. So we've got, at every one of our sites, we actually have an infirmary set up, and we have the medical logs there, and the medical logs stay behind. There's some booklets I'll show you in a minute that you can take back with you that have to do with medications that kids have to take or kids might want to take. So if they, you know, want some Tylenol, you'll write that down as, you know, they want to take it, versus a kid who's bringing medication that says they need to take one of these pills every breakfast. So, and we understand your liability of, you know, at some point you may be asked to show that you gave that child only one pill per breakfast meal, and you want to be able to log that. So I'll show you that in just a little bit. UCCR also does not provide first aid supplies, so it's your responsibility to inventory your needs and bring the necessary supplies that you need. Now, at all of the UCCR facilities, again, we do have an infirmary, and we have installed a locked cabinet for our property owners. You know, you folks who are watching this webinar, there's a locked first aid cabinet there, so you don't have to take your first aid stuff home every year. You can actually, just at the end of your season, you can just take an inventory of what's needed and then come back next year with your inventory. But we lock it to make sure that other groups that use the infirmary don't use your first aid supplies. So your pre-camp responsibilities, really important. Again, just, you know, not showing up at camp and going, okay, let's start with our healthcare responsibilities at camp. There's the pre-camp responsibility. So very early in your planning, your camp director will need to provide you with as much information as possible about the camp program as it relates to your responsibilities, such as what is the age range of the campers. There's going to be different issues with different age ranges. How many campers will be in attendance? What is the gender breakdown? How will the campers be grouped? When were the health forms sent out to the campers and the staff? When and where will they be returned? What's the daily schedule of activities? That's good to know, because if everybody's swimming at some time, or everybody's hiking at one time, if everybody's in the Gaga pit at one time, if everybody's on the ropes course at one time, it's really, really good for the health provider to know that. What facilities will be available for you to use as your healthcare providers, and how are the campers getting to and from the camp? So the staff and counselors are your eyes and ears, and that is so important, to have the staff and counselors are your eyes and ears during activities in the cabins. So you need to train the staff so they know what to look for and listen for regarding illness and injury of campers. So what to look for, just an obvious one would be a camper that shows up as, you know, full of, you know, energy, ready to go, running around, and then 3 days later is just dragging. And, you know, maybe they're just tired, and so you kind of give them that. And then the next day they're dragging even more. In my experience, they're probably dehydrated. Kids don't drink enough water. You know, there's I think a lot of smart counselors and even healthcare providers require that the staff make sure that the kids drink a full water bottle every morning. They drink a full water bottle at lunch, and they drink a full water bottle in the afternoon. Dehydration is one of the main things that kids just aren't used to running around, especially these days with computers and video games and all that kind of stuff. You know, and if they live, say, in a cold area, or say they live in San Francisco in the fog all summer, and they take a car or a bus ride and they get off and it's 89 degrees where they're at. They're not used to that. So anyway, you just need to make sure that the staff that's with the kids know what to look for and listen for. Maybe it's in the cabins at night. You also need to make sure that your staff know that, if there's a high fever, that child's going to be isolated. High fever can spread. High fever could be the first signs of a norovirus or a stomach flu. And stomach flu spreads fast. All of us in the camp business have heard those horror stories of, one kid getting the stomach flu and all of a sudden the next day 30 kids have the stomach flu. So make sure your staff know that signs of flu, you definitely need to isolate that camper right away. So health forms. So as I said, each camper staff member and director, as well as yourself, have a health form, and on that health form is a signed release. So the camp director's responsibility is to be sure that all the health forms are sent out to the campers well in advance. The health form should be returned to the camp director, and then the camp director should give you those forms with enough time for you to review the forms, and if need be, to contact the parents or the guardians regarding questions. So in a lot of the medical forms these days, they ask, hey, is your child or is your camper able to participate in all the activities that are listed on our brochure or our flyer or our website? And if you get a no without an explanation, you want to find out pretty quickly what that no is all about. Is that no all about food? Is it about an environmental situation, so they're afraid of heights and part of the camp is rock climbing or it's ropes course, or is it have to do with medical allergies? So you want to track down any of those mysteries and unknowns before camp begins. So reviewing those health forms, super important before camp begins. So emergency preparations, there's going to be situations that are beyond the scope of your training and ability, and you're going to need to seek outside assistance. So all of our UCCR facilities have a relationship with an emergency medical group. It could be the local volunteer fire department or the fire department, or it could be an ambulance group. So if somebody's ambulatory, you need to get a hold of the UCCR site director, unless of course it's a 911 call. Life-threatening emergency is a 911 call, then you would call 911 right away. But if you're not sure if it's a 911 call and you just need an ambulance, probably best to get a hold of the site director and let the site director help you with that. Let's see. Also in the terms and conditions, which we'll look at in a little bit, terms and conditions are on the back of the contract that your organization signs to use the UCCR facility. It states that you as the healthcare provider, you as the group using the facility, will provide emergency medical transportation. So that's a big one, obviously, for cost. So just a quick example would be, let's say that a camper rolls their ankle and it's, black and blue and swollen, and nobody's really sure if it's broken or if it's just badly sprained, and you want to get them to a place where they can get x-rays and get it looked at. Calling an ambulance for that is a little overkill, and it's going to be expensive for the parents. And so if you have a vehicle with you and you can transport the camper to the clinic or the hospital for x-ray, you're much better off, and probably relationships with the parents would probably pay off too down the road in that case. UCCR does carry health and accident insurance policy for all program participants. So that policy right there is meant to be a secondary policy. So if a camper gets hurt, obviously, if they have primary care, then the primary coverage would want to be used. There are circumstances where the parent may say, no, I don't want to use you'd call it a parent, and the parent say, well, is there secondary coverage available? Well, there is secondary coverage available that UCCR has. And that secondary coverage is a coverage between between the injured and the company that we carry that policy with. And the maximums are very small. I think injury is like $5,000 and illness is $3,500 maximum on all those. So UCCR has a form. They'd fill out the form, give it to the injured person, and say, hey, now this is between you and the carrier, listed up here in the corner. And at times, sometimes there's campers that don't have any type of primary care, and that's why this is good. And again, this would be perfect in an example of going to get an X-ray to make sure, see if the ankle's broken or not, where this whole policy would pay for the X-ray. So, and then down here you can see the steps to facilitate the claims process. You'd log the injury. You want to make a record of it, so you log the injury in the medical log. As a healthcare provider, you'd complete part 2. UCCR completes part 1, and then the form goes off with the injured party, and the injured party follows up. So your responsibilities during camp: arrive several hours early to get oriented and prepared for staff and camper arrival. Make sure the infirmary is ready to go. You know where the first aid supplies are, and you understand what the emergency procedures are if an emergency comes up. Each staff member and camper needs to be screened by the health provider at the beginning of the camp. Greet and establish contact. Inform the staff and camper of the infirmary location. Hey, if you need me or need the infirmary, this is where it is. Inquire about changes in the health or medication since the medical form or registration form was filled out. Something may have come up since you received the medical form. Take a look at each staff and camper person. Just look them up and down. I know some campers even go as far as doing a lice check in the hair, those types of things. Receive any medications, and you take those medications. All medications need to be locked at camp, and UCCR also provides a locked medication cabinet separate from the locked first aid cabinet, and also a locked refrigerator for meds that need to be refrigerated. If the parents are there or the guardian is there, just, you're checking out the kid visually, but make sure you take time to ask the parent or guardian, hey, is there anything I need to know about here? Usually there's not. They just say, no, I think my child's going to have a great time. Check on their allergies, double check to be sure all medical and treatment releases are signed and dated. Good. If all the kids are showing up at one time, it could be gridlock. So what you would want to do is announce a wide time, or have your camp director announce a wide time of camper arrival. So if you say everybody arrived between 1 and 2, and then everybody arrives between 1 and 2, and then they do their check-in at the main table, and then they get sent over to the healthcare person to check. You're going to create a long backup for the healthcare provider. So you want to, allow for a window of arrival so the healthcare provider doesn't get all backed up. Let's see, medications and medication log down here at the bottom of this page. Logging, maintaining, and dispensing medications is a major task of the healthcare provider. As I mentioned, you need to collect the medications. Campers of the age of 18 are not allowed in the possession of any medications. There's 2 types of medications, as I described earlier. One is called regularly prescribed. Those are the ones that, hey, look, with every meal, camper so-and-so needs to take a pill. And then there's those as needed, and those that are as needed are like, oh, geez, I got shin splints and I really need to, get some Tylenol. So you want to log all that. Be sure that everything you give out is logged, okay? Really important that everything you give out is logged. And you want to log in the medications you get. So when you receive a medication, most of the registration forms these days state that do not send the entire prescription bottle. If your camper's going to be with us for 7 days and only needs 7 pills, needs only 1 pill each day, send 7 pills in that prescription bottle. So the doctor's name is on that prescription bottle, and the prescribed amount of medication to take every day is on that bottle too. The parent should just empty the bottle out, put 7 pills back in the bottle, keep the other pills at home, and then when the camper leaves, you want to make sure that you are giving those bottles, those prescription bottles, back to the camper so they can take those back home, and the parents can put the pills that they withheld back into the bottle. Okay, let's get down here to the middle of the page. UCCR has provided 2 sets of logs to assist with dispensing meds. As I said, the regularly taken, and then there's the as needed. Those are a legal record that you have fulfilled your obligation to dispense the medications, particularly with the regularly taken. The medical log is a kind of a spiral-bound notebook, actually, that is at every UCCR facility. And that site medical log is, you need to write down everything. So not just when you give out medications regularly or as needed, or somebody, you had to scrape their knee real bad but didn't need stitches, but you had to irrigate it and kind of get the gravel out of it and then patch it up a little bit. But if somebody comes to you with a headache, if they come back to you again and again and again with a headache, it's good to have a log that so-and-so had a headache every day while at camp. You never know what might happen when they go back home. So that site medical log, you want to log everything that happens in your infirmary, or if you're called out to a recreation field or a swimming pool or something to provide health care, which is another important point, which is you need to have 2 people be available for your infirmary. So if you are called, if your healthcare provider is called out to the athletic field because somebody sprained their ankle or something, you can't leave your infirmary unattended if you have campers in your infirmary. You can't leave a camper unattended in your infirmary. You need to have backup. So maybe you have a radio and you can call and whoever and say, hey, I just got called out to the athletic field. I need you to come in and sit with so-and-so while I go out. Could be 2 of you in the healthcare in the infirmary all the time providing healthcare, but you don't leave campers alone in the infirmary. Remember, you are on call 24 hours a day, so that sounds like a lot. But again, in reality, if you have a good camp and you do your work in advance, if the healthcare provider does their work in advance of screening and reviewing all the forms and rescreening the campers as they show up, and you're organized, you shouldn't be working 24 hours a day. That's probably just not going to happen. So you will get some sleep. Let's see, I mentioned medications must be returned to the parent or the adult. Just a review of your duties: receive and review and possess the health forms, provide first aid, specialized medical supplies, enlist and train camp staff to be your eyes and ears, screen all staff and campers upon arrival, store all the meds properly, and you want to log them when you get them, dispense them as you're supposed to, have set hours for the drop-by camper needs. So a camper is supposed to take a pill at noon. They can come by and get their pill and take it right there in front of you. Don't have them take it to the dining hall, because one thing we know is that kids don't like to be singled out. They don't like to be the one going up to the window to get the vegan meal if nobody else is getting a vegan meal. They don't want to have to take a pill in front of their friends or actually strangers if nobody else is. It just makes them uncomfortable. Log all the actions in the site medical log, respond to emergencies, participate in the life and program of the camp experience, respect the confidentiality of campers and staff. And so if you have a new healthcare provider, please work with them on the confidentiality of being a healthcare provider. It's so important that everybody's needs are taken care of, but then those needs are confidential to those who are taking care of those needs, that they just don't become widespread. Did you know so-and-so has this disease, or so-and-so has this issue, and blah, blah, blah. That's just not a good way to go. So here's an example of a medical form. As I said, this is so this one here on the second page gets to some of the questions that weren't on medical forms years ago, which is, is your child a vegetarian? Instead of just can we give your camper aspirin? Now we ask, may the camp healthcare provider administer Tylenol or Pepto-Bismol or cough drops? So there's some, a lot more specifics on there. And again, if you need a camp registration or healthcare form, we can help you with that. Release statement must be signed by parent or guardian. I can tell you, no camp is going to accept a camper unless it is signed by a parent or guardian. I've been at camps as an ACA visitor for arrival and seen this happen, and it's sad. The camper really wants to get there, and the parent might ask to drive 4 hours or whatever because the kid took a bus to get there. So here's a medication example of a medication prescription form. Child's name, the type of medication, why they're taking the medication. The enclosed medication is to be taken as needed or taken at specific times. And then an example of the medications to be taken or dosages to be taken. Let's see here, and that's it on that. So let me show you some of these other forms that we have here. I mentioned the UCCR terms and conditions. So on the UCCR terms and conditions, this is the back of the contract that each group signs to use a UCCR facility. You can see in section 7 there, health and safety. So this whole section addresses what the group using the UCCR facility agrees to provide in the terms of health and safety while they are at a UCCR facility. I mentioned the camper accident form, and currently our secondary policy or camper accident form is with United States Fire Insurance Company. And I think it's important for you to realize that not everybody remembers that this form is available. So anyway, there is a form. Just wanted to make sure you saw that there's a form. The as needed medical logs. So as I said, there's the as needed, which is child needs Tylenol, didn't think they did, but all of a sudden they do. So this is what the cover of that looks like, and these will be available for you. Inside the booklet is the log itself. And the last form here I wanted to show you is the regularly taken medication, and then this is the outside cover. On the inside is what is the actual log. So I wanted to keep this to 45 minutes, and looks like we're about right on time. So we will now, Tina, you want to open it up to questions?
Sure. Thank you, Mike. That was great. And just to be clear that these logs are available at the camp, and the site director has these, and we'll be able to provide those to the healthcare providers at each camp session. Anybody have any questions or anything they want clarification on, or just something they were thinking about while Mike was presenting? You can unmute your microphone and go ahead and ask a question if you have anything, or comments even.
I was wondering, Camp Tamarack is no longer under UCCR, but I was wondering if we would be able to get that manual that you were going through for our camp.
Yeah, sure would be. And in fact, when we transitioned, what is that? Holy mackerel.
Wow.
Okay, luckily that went away. Maybe that was a siren passing by somebody. So,
no, I think it's something with your microphone, Mike.
okay, so what we did when we transitioned out of Camp Tamarack is we actually left all that information in here. Uh-oh. Can you hear me, Tina?
Yeah, it's the challenges of modern technology.
So when we transitioned out of Tamarack, we left examples of all that information there. And if you can't find it, if you want to get a hold of me, I'd be happy to send this to you. Easy enough. Easy enough.
You know what? That's a great idea. You know, you can, I don't know if you got the email that was forwarded from me. You can email me or you can email Mike at uccr.org. So, and he can just send you, I think that would be great, Mike, if you want to just, if people want the copy of the booklets, then you can just email it to them directly.
So my email address again is mikec, M-I-K-E-C, at uccr.org. And if you have any questions about healthcare providing too, just give me a call. You know, I've been, before I joined up with UCCR, I worked with another organization and was deep into their safety and healthcare program also.
Great, thanks, Mike.
Mike, are those lowercase or uppercase letters? Does it matter?
Does not matter.
Okay. Thank you.
And Jan is in the echo chamber. Yeah, other questions or comments? Anything? Okay. Yeah, Jan, go ahead.
I have a question about your medication logs. What do the inside pages look like?
It's a log, Jan. So it would be name of the camper,
Like date and time and
date, time, medication taken and how much medication taken. And then actually there's a signature that the healthcare provider also has to sign off each time they provide.
okay, it's probably like the one we're using at Harmon Center.
It is, yeah. It's you have these at Hartman Center.
Did they just arrive last year?
They should have been there the first year we were there. I'll check with Zach and to make sure that he has enough of them. He may have run out at some point, but I'll check with him today.
Okay, because last year we were still using the ones that we had used previously.
Okay. Thank you for letting me know. I'll check on that today.
Okay, thanks.
Well, thank you all for attending today. And if you want another recording, you know, if you want the recording to pass on, I have some emails of people who have requested it. So thank you, Mike, for taking the time to walk through healthcare provider at camp. Great material. So thanks all for being here. We're going to be doing another webinar in September, topic to be determined, but we will certainly let all the conferences and regions know what we're up to. Thanks again.
Thank you very much.
Thanks all. Stay in touch if you need to. Good luck this summer.
Thank you. Thank you.